Welcome, everybody, to the Texas Primary Care Consortium's monthly Monday Primary Care Talks. My name is Nishi Singhal. I'm the program officer with the consortium. Every month, we are dedicated to interviewing guest speakers from across Texas, covering a wide range of primary care topics. Each month, we are bringing you informative episodes as your go-to resource on all things primary care. Today is no different. We will be talking to Celia Cole. She's the CEO of Feeding Texas, the state association of food banks. Feeding Texas Network collaborates with over 3,000 local partners to increase access to nutritious food for people facing hunger, improving community nutrition, and mitigating the root causes of hunger. Prior to Feeding Texas, Celia served as a senior food policy analyst at Every Texas, a public policy research and advocacy organization. Over the course of her 25-year career, Celia has led advocacy campaigns to strengthen federal nutrition programs, established a statewide produce collaborative to increase access to fresh produce, and forged cross-sector partnerships with diverse stakeholders to increase food security, improve health outcomes, and build a robust response to hunger. Let's go to the show. Thank you, Celia, so much for joining us today. I'm so excited to have this conversation with you and to connect with you. If you could tell us a little bit more about yourself and even how your work impacts our primary care system, I would love for our listeners to just get to know more about you, but really how does your work connect back to the work that our consortium audience is also engaging in?
Course. Well, thank you so much for including me in this conversation, Nishi. I really appreciate it. I'm excited to be here today. So I'm Celia Cole. I'm the CEO of Feeding Texas, which is the state food bank association. So our network includes 20 food banks that collectively reach every county of the state through a network of about 3,000 local partners. And they provide not just food, but access to benefits enrollment, like getting people connected to SNAP and Medicaid and CHIP. But they also offer kind of a suite of services really designed to kind of tackle those upstream causes of food insecurity, but also the downstream consequences. And health, and poor health, I think in particular, are both one of those upstream causes and those downstream consequences, because the way that poor health and food insecurity interact, it creates kind of this vicious cycle. Whereas if you don't have enough money to buy nutritious food, that can lead to poor health. That in turn can keep you out of work. It can lead to higher medical costs. That in turn can make you even more food insecure. And so it's really a vicious cycle. And so in the food bank world, we see hunger and health as being deeply connected. And so we're really committed to kind of leveraging food banks and food bank services to improve health through improving good nutrition. And the way we do that, obviously, is by looking to increase people's access to healthy food, whether that's by giving it to them directly, enrolling them in SNAP so they can purchase it themselves, or other nutrition programs like WIC, but also then working to figure out how can we help break that cycle of food insecurity so people can afford nutritious, healthy food on a consistent basis, all of their on their own. So I think people often think of primary care as like, I'm just going to go to my doctor when I'm sick. And in reality, probably the overarching purpose of and goal of primary care is to keep people from getting sick in the first place through things like well checks. Um, and so as particularly healthy, I'm very lucky to be very healthy. My kids were healthy. So I really, the only times of the year that I do go to the doctor are for well checks. And so I think that sort of prevention piece often gets overlooked when you think about primary care. You think about it as I have a cold, I go to the doctor, I have whatever, I'm not feeling well, I go to the doctor. But really, to me, primary care is about like keeping people healthy in the first place. And one of the best ways to do that is to make sure that people have access to nutritious food, that it's affordable, and that, they understand how to use it. And I think that's particularly important for people who have limited income is, how do I shop on a budget? And then when you're introducing people to fresh fruits and vegetables, particularly like what's available locally, it may be something they've never seen before. So how do I cook it? And why is this an important source of food? And then I think when it comes to things like chronic disease, obviously it gets much more targeted in terms of what or the most important foods for example, high risk pregnant women to be eating. So yeah, I see food as being, just an inextricable part of medicine. Kind of goes back to things that it was something we've all heard from our mothers at one point in our lives, which is an apple a day keeps the doctor away.
Oh, I love that. That's such a good point actually. And you touched on this. But how would you define primary care? I definitely heard you say words like prevention, right? We're not only going to our primary care provider when we are sick, but it's also a preventatory, connection to have with that person.
Yeah.
I guess in your own words, yeah. How would you define it?
I think it's about keeping people well in the first place so that they don't need to access more specialized care or they don't develop chronic illness. So it's about identifying problems early, preventing problems before they happen. And then also, I think the medical home is super important, obviously, and that's a critical part of primary care is a place where people go where they feel like they can trust their doctor, that their doctor understands them, that their doctor is culturally competent. Because I think often people avoid preventive care because they don't feel that connection. So I think it's also about a medical home.
I'm already getting so excited about this conversation. I want to ask you so many questions. And so, as I'm listening to you speak, it's reminding me of what I am seeing that HEB is doing. Like HEB now has these little clinics, right? That I think is literally part of their grocery store. And I visited one last year, and it's cool because it gives you this physical access of like, okay, you're going grocery shopping, let me go see my doctor, or vice versa. But another part of it is that they had nutritionists as part of their clinics that would literally take you inside the grocery store, right? And say, okay, you have, your blood work is showing us this, this, this. It'd be best if you ate this and you stayed away from this, and this is how you cook it. And so I just loved watching that model and just watching that in action. I guess my question for you is that's like one example of how, the primary care system can support people accessing healthy and nutritious foods, right? What do you feel like would be helpful for you that primary care did? Like whether it's at the physician level, whether it's at the hospital level or the payment level? Like I think essentially the question I was going to ask is like, what primary care challenge are you currently working on to alleviate? And maybe more specifically, what could primary care do to, I think, better enable that access to healthy foods?
Well, I think the first step is having primary care physicians and hospitals and clinics really understanding the link between good nutrition and health and food insecurity. So all doctors know the importance of good nutrition. We hope. I know there's obviously a push to include more nutrition classes in med school, and I think that's really important. Is to not again think about nutrition and good nutrition as something separate from good health. But I think screening for food insecurity is probably the most important thing we can make sure that providers are doing on a regular basis, that they understand how to do it, and that they do it in a way that doesn't make the patient feel stigmatized. Because I think that's one of the biggest challenges that we all face in diagnosing food insecurity is that people feel shame to admit that they may not be able to afford food. So how can we get all primary care providers comfortable doing food insecurity screenings and doing it in a way that's really dignified for the patient? So I think that's probably the most important step. And then I think once you've got that in place, um, again, figuring out like when say a doctor determines that someone is at a nutritional risk and says, look, you really need to be eating X, Y, and Z, and understand you may struggle with food insecurity and struggle to afford that, then not making a referral without knowing that it's going somewhere where it can be filled. And I think this is where we're at right now. So we have guidance that says you have to screen for food insecurity. We've got House Bill 1575, which is focused on identifying the non-medical needs of pregnant women in Medicaid, and then referring them out, doing that kind of work through the community health workers. But what happens then when they are told, given the referral, and it can't get filled because there's not a place that they can go to get access affordable food. So I just think really understanding that connection is important.
Sorry about that. And yeah, I love that. Do you feel like people are understanding that connection? And do you think there needs to be more education? And if so, who can we educate, to kind of blend in that those examples that you were just sharing of ways that both kind of
Yeah,
systems
well,
can work together?
I mean, it's a newish requirement, right? And so I think it always takes time for new requirements like that to become routine, sort of a routine part of a primary care visit. So I think, yeah, the more education with doctors and other providers to get them comfortable and help them understand the link between food insecurity and poor health, and if understand if their patients aren't following their doctor's advice, which patients do at all income levels. So I'm not just singling out low income people, but is the why behind that they simply either don't have the money or can't access the good food. So I think just helping understand that link. You know, I would guess if you did a survey of sort of all doctors in the state of Texas that or you did a quiz around sort of the extent, the scope, the severity, the pervasiveness of food insecurity, I don't think any of them would score very high on that quiz because people have a hard time comprehending that in a state like Texas of abundant wealth and agricultural abundance, that people could be really going without something as critical as food. So I think if you told people, hey, 1 in 6 Texas households is food insecure, and 1 in 5 kids are in a household that's food insecure, and in rural areas and in Black and brown communities and among seniors and people with disabilities, those rates are even higher. And I think that would really surprise a lot of providers. And so I think education, not just about how to do food insecurity screenings in a dignified way, but also just helping the medical primary care system understand, that it's the extent of the problem in Texas. We have the second highest rate of food insecurity in the nation.
Yeah, thank you. And I want to end on a positive note, which is if you had a magic wand, what is one change you would love to see, in our healthcare system, in the primary care system that could really better benefit what you were just saying, that, again, people have access to healthy and nutritious foods?
I think the funding to make sure that if you're going to treat food as medicine, then it should be reimbursed the same way that every other kind of medical care is. And it's so much cheaper to help people eat better on the front end than it is to treat diet-related illness on the back end.
I love that. Thank you. Thank you, Celia. This has been so great. I'm so happy that we are having this conversation. Celia and Feeding Texas is also part of the consortium's consensus panel where we are discussing our policy priorities for the upcoming legislative session. And I guess I almost want to give ourselves a pat on the back that we are building these connections, that we are building these, I guess,
Yeah.
kind of more like non-medical drivers of
Yeah.
health connections, right, with different stakeholders. So
Right. But it's not odd
yeah,
that a food group is part of a primary care group. It's like that should be a logical connection. And I think also just the more we can do to co-locate food assistance and medical care, like you mentioned with HEB, having clinics in their grocery stores. Food banks have done that a lot too. They have tried to co-locate mobile feeding units with healthcare. Obviously, it's all about sort of meeting people where they eat, work, learn and pray. So I think meeting people where they are is super critical.
Thank you so much, Celia. That was so informative. And I love learning about the intersection between access to healthy foods and primary care, and really how we can strengthen the primary care system to better give people access to nutritious, healthy food. Thank you so much for joining us today. If you have any questions for us or Celia, please feel free to reach out to us, and you can also reach out to Celia. And we will join you next month for Texas Primary Care Consortium's Primary Care Talks. Thank you.